Nobody tells you that the symptom feels exactly like getting older. That's the problem. You wake up twice at night to use the bathroom, and you think, well, I'm 72 now. You feel a slight burn when you urinate, and you assume it's something you ate. You notice the stream isn't what it used to be, and you tell yourself that's just how aging works. And while you're normalizing these signs, while you're accepting them as inevitable, a cancer that could have been stopped in its tracks is quietly establishing itself in your prostate. I met Thomas on a Tuesday morning in 2019. He was 74 years old, a retired postal worker from Lahore, and he'd been ignoring a symptom for 11 months. Not because he was careless, not because he didn't care about his health, but because that symptom felt so ordinary, so mundane, so much like every other minor inconvenience of aging that he genuinely believed it wasn't worth mentioning. By the time his daughter insisted he see someone, the cancer had spread beyond the prostate capsule. We caught it, we treated it, but those 11 months of silence cost him options he'll never get back. Here's what nobody tells you. Early-stage prostate cancer produces symptoms that are almost identical to benign prostate enlargement. The medical term is BPH, benign prostatic hyperplasia, and nearly every man over 60 has some degree of it. Your prostate grows. It presses on your urethra. You experience urinary changes, completely normal, completely harmless, and completely indistinguishable from early cancer without proper screening. That overlap is killing men, not because prostate cancer is untreatable. It's one of the most survivable cancers when caught early, but because men are mistaking cancer symptoms for normal aging and waiting until those symptoms become unbearable. This video is about one specific warning sign that millions of senior men are ignoring right now. Not vague discomfort, not occasional inconvenience. A measurable, identifiable change in urinary function that appears in approximately 73% of early-stage prostate cancer cases and gets dismissed as just getting old in nearly 90% of those men. I'm going to tell you exactly what that sign is, why it happens, what it means for your body after 60, and what you need to do starting tonight if you're experiencing it. Stay with me. My name is Dr. Rashid Ahmad. I'm a urologist and oncological surgeon. I've been practicing for 28 years. I've performed over 1,800 prostate surgeries, from simple TURP procedures to radical prostatectomies for advanced cancer. I've held prostates in my hands that weighed 30 grams and prostates that weighed 120. I've removed tumors the size of peas and tumors that had infiltrated surrounding tissue so extensively we had to reconstruct the bladder neck. I've sat with men in their 60s who walked out cancer-free 6 weeks later, and I've sat with men in their 80s who waited too long and ran out of curative options. What frustrates me, what keeps me working past retirement age, is that most of the late-stage cases I see didn't have to be late-stage. These men had symptoms. They felt changes, but the medical system we've built tells men to wait until something is really wrong before seeking help. We've normalized suffering. We've pathologized caution. A man who goes to his doctor and says, "I'm urinating more frequently, but it doesn't hurt. So maybe I'm wasting your time," is not being paranoid. He's being responsible, but too many doctors wave him off with, "Let's wait and see," and too many men accept that because they've been taught that real men don't complain about discomfort. I'm telling you now, that approach is outdated, dangerous, and costing lives. Here's what you need to understand about your body after 60. Your prostate sits directly below your bladder, wrapped around your urethra like a donut around a straw. When you're young, it's about the size of a walnut, maybe 20 grams. After 60, it starts growing. For most men, this growth is benign. The prostate gets bigger, the urethral channel gets narrower, and urination becomes more effortful. You push a little harder. You wait a little longer for the stream to start. You go more often because your bladder doesn't empty completely. This is BPH. It's annoying, but it's not cancer. But here's the critical detail. Prostate cancer also causes growth. And in the early stages, that cancerous growth produces the exact same urinary symptoms as benign growth. Same frequency, same hesitancy, same weak stream. The only difference is what's happening at the cellular level, and you can't feel that. You can't distinguish benign tissue from malignant tissue based on how it feels when you urinate. You need a blood test. You need imaging. You need a biopsy. Without those tools, you're guessing. And millions of men are guessing wrong. One statistic, in Pakistan, approximately 62% of prostate cancer cases are diagnosed at stage 3 or IV. That means the cancer has already spread beyond the prostate by the time we find it. In countries with aggressive early screening programs, like the United States or Germany, that number is below 25%. The cancer itself isn't different. The biology isn't different. What's different is that men in those countries are catching the early warning signs and acting on them, while men here are waiting for pain, waiting for blood, waiting for something dramatic. And by the time drama arrives, the window for easy treatment has closed. Now let me tell you about the warning sign. It's called nocturia. That's the medical term for waking up at night to urinate. Specifically, waking up 2 or more times per night, consistently, over a period of weeks or months. Not occasionally, not after drinking too much tea before bed, but regularly, predictably, night after night. Here's the mechanism. As your prostate enlarges, whether from BPH or cancer, it compresses your urethra. That compression prevents your bladder from emptying completely when you urinate. So even though you just went to the bathroom, there's still 50 or 60 milliliters of urine sitting in your bladder. Your bladder interprets that as still full and sends signals to your brain, you need to go again. During the day, you're distracted, you're moving, you ignore those signals. But at night, when you're lying still and your body is in rest mode, those signals become impossible to ignore. You wake up, you go to the bathroom, you urinate a small amount, you go back to bed. 2 hours later, it happens again. Most men assume this is normal aging. And in some cases, it is. BPH alone can cause nocturia. But here's what makes nocturia a critical warning sign for cancer. Cancerous growth tends to be asymmetric and nodular. It doesn't enlarge the prostate evenly. It creates lumps, hard spots, irregular tissue. And that irregular tissue often presses on the bladder neck or posterior urethra in ways that produce more severe nocturia than BPH alone. If you're waking up 3, 4, 5 times a night, that's not just benign enlargement. That's a red flag. After 60, the risk compounds. Your bladder muscle weakens. Your kidney function declines slightly, which means your body produces more urine at night, and your prostate continues growing. All of these factors together mean that nocturia becomes more common as you age, but that doesn't mean it's harmless. It means you need to distinguish between nocturia caused by natural aging and nocturia caused by cancer, and the only way to do that is screening. Let me give you an example. I treated a man named Salim in 2021. He was 68. Retired school teacher. He'd been waking up 3 times a night for about 8 months. He mentioned it to his wife, who told him to drink less water before bed. He tried that. It didn't help. He mentioned it to his brother, who said, "Welcome to old age." He accepted that. Meanwhile, his PSA, that's prostate-specific antigen, the blood marker for prostate issues, was climbing. We didn't know that yet because he hadn't been tested, but it was rising. By the time he finally came to see me, not because of the nocturia, but because he started seeing blood in his urine, his PSA was at 14. Normal is below 4. A biopsy confirmed adenocarcinoma, Gleason score 7. We treated him aggressively, radiation and hormone therapy, and he's cancer-free today. But if he'd acted on the nocturia 8 months earlier, we could have caught it at stage Y and done a simple prostatectomy. Less invasive, fewer side effects, better quality of life. Write that down. Waking up 2 or more times per night to urinate consistently for more than 4 weeks is not normal aging. It's a signal, and you need to respond to it. Here's what you do starting tonight. First, track it. For the next 7 days, keep a simple log. Write down how many times you wake up to urinate each night. Write down the time. Write down approximately how much you urinate. Just a rough estimate. A lot, a little, barely anything. This log gives your doctor objective data instead of vague impressions. "I think I go a lot at night" is different from "I woke up 4 times last night, 3 times the night before, and 5 times on Tuesday." Second, schedule a PSA test. This is a blood test. It measures prostate-specific antigen, a protein produced by prostate cells. Elevated PSA doesn't automatically mean cancer. BPH can raise it too, but it tells your doctor there's activity in your prostate that needs investigation. If your PSA is elevated, your doctor will likely order a digital rectal exam and possibly an MRI or biopsy. I know that sounds invasive. I know it sounds uncomfortable. But discomfort lasts 10 seconds. Untreated cancer lasts a lifetime. Third, don't let anyone dismiss your concern. If your doctor says, "It's probably just BPH, let's wait and see," push back. Say, "I'd like to confirm that with a PSA test." If they resist, ask why. If they still resist, find another doctor. I'm serious. Your health is not negotiable. And waiting to see if symptoms get worse is not a diagnostic strategy. It's a gamble. Now let me address the fear I know some of you are feeling. You're thinking, if I get screened and they find cancer, my life is over. That's not true. Prostate cancer caught at stage I has a 5-year survival rate above 98%. Stage 2 is still above 95%. Even stage 3 is survivable with aggressive treatment. What's not survivable is stage 4 cancer that's metastasized to your bones or lymph nodes, and that's what happens when you ignore early signs and wait for pain. Let me also address the other fear, treatment side effects. Yes, prostate surgery and radiation can cause incontinence and erectile dysfunction. but modern techniques have dramatically reduced those risks. Nerve-sparing prostatectomy preserves erectile function in 70 to 80% of cases. Robotic surgery reduces blood loss and recovery time. And even if you do experience side effects, we have treatments for those too. Medications, physical therapy, penile implants. These are manageable issues. Death is not manageable. Here's the second warning sign, and this one's even more ignored: hesitancy. That's the medical term for the delay between when you stand at the toilet and when urine actually starts flowing. You're standing there. You're trying. Nothing happens. Then, after 5, 10, 15 seconds, the stream finally starts. Most men don't even notice this because it develops so gradually. You don't remember that urination used to be instant. You've adapted. But hesitancy is a direct result of urethral compression, and in men over 60, it's often the first physical sign of prostate enlargement. Cancerous tissue is denser than benign tissue. It compresses harder. And that means hesitancy tends to be more pronounced in early cancer than in BPH alone. If you're experiencing both nocturia and hesitancy, if you're waking up multiple times at night and then standing at the toilet waiting for the stream to start, you need screening immediately. Not next month, not when it gets worse. Now, here's what nobody tells you. Most men wait until they experience pain or blood before seeking help. But by the time prostate cancer causes pain, it's usually advanced. Early-stage prostate cancer is asymptomatic in terms of pain. It doesn't hurt. It just changes your urinary pattern. And if you're waiting for hurt, you're waiting too long. Let me tell you about the third sign: weak stream. Your urinary stream should be forceful. It should arc. It should hit the back of the toilet bowl without effort. If your stream has become weak, thin, dribbling, or if you have to push with your abdominal muscles to get urine out, that's urethral obstruction. Again, this can be BPH, but it can also be cancer. And the only way to know is testing. Think of your urethra like a garden hose. If someone steps on the hose, water still flows, but the stream weakens. If they step harder, it becomes a trickle. That's what an enlarged prostate does to your urethra. But here's the key. Benign enlargement usually affects the entire prostate evenly, so the compression is symmetrical. Cancerous growth is often asymmetric, which means the compression can be more severe on one side. That asymmetry produces a weaker stream earlier in the disease process. The fourth sign: incomplete emptying. This is the sensation that you haven't fully emptied your bladder even after urinating. You finish, you zip up, you walk away, and within minutes you feel like you need to go again. That's because you do. Your bladder didn't empty completely. There's residual urine sitting there, irritating the bladder wall, triggering the urge to urinate again. Residual urine is dangerous for two reasons. First, it's a breeding ground for bacteria. Men with chronic residual urine are at much higher risk for urinary tract infections, which in seniors can lead to sepsis. Second, over time, residual urine stretches the bladder, weakening the muscle. Eventually, the bladder loses its ability to contract properly, and you end up needing a catheter just to urinate. I've seen this happen. It's preventable, but only if you act early. The fifth sign: urgency. This is a sudden, intense need to urinate that comes on with little warning. You're sitting in a meeting, or driving, or watching television, and suddenly you need to go right now. Not in 5 minutes. Now. This happens because an enlarged prostate irritates the bladder neck. The bladder interprets that irritation as, "I'm full," even when you're not, and sends emergency signals to your brain. Urgency is common in BPH, but it's also common in prostate cancer, especially when the tumor is located near the bladder neck. Here's the cliffhanger. I need you to understand before we go any further. Every single one of these 5 signs can be caused by benign prostate enlargement. None of them, on their own, definitively mean cancer. But that's exactly why they're so dangerous. Because men assume it's probably just BPH, and they don't get tested. And in approximately 30% of cases, it's not BPH, it's cancer. And every month you wait is a month that cancer is growing, spreading, moving from curable to manageable to terminal. So here's the question you need to ask yourself right now. Are you willing to bet your life on probably? I want to take you into the operating room for a moment, not to scare you, but to give you perspective. When I perform a radical prostatectomy, I'm removing the entire prostate gland. It's a delicate surgery. The prostate sits between the bladder and the urethra, surrounded by nerves that control erectile function and sphincters that control continence. Every cut I make has to be precise. 1 millimeter too far in the wrong direction, and you lose function. But that precision is only possible when the cancer is confined to the prostate, when it's still encapsulated, when we can see clean margins. When a man waits too long, when the cancer has spread beyond the capsule into surrounding tissue, that precision becomes impossible. I can't remove just the prostate anymore. I have to remove tissue around it. I have to sacrifice nerves. I have to accept that, even with the best technique, there will be side effects. And in some cases, surgery isn't even an option anymore. The cancer has spread too far. We move to radiation, hormone therapy, chemotherapy. We're no longer curing. We're managing. I think about the families in the waiting room. Wives who've been married for 40 years, waiting to hear if their husband will survive. Sons and daughters who flew in from other cities, sitting in plastic chairs, drinking bad coffee, trying not to imagine life without their father. And I think about how many of those moments could have been avoided if the man had simply acted on nocturia 6 months earlier. Here's the confession I need to make. I've lost patients who shouldn't have died, not because we lack skill or technology, but because they came to me too late. They ignored symptoms. They normalized discomfort. They told themselves, I'm just getting old. And by the time they walked into my office, the cancer had metastasized to their spine, their pelvis, their lymph nodes. We treated them. We gave them more time, but we couldn't cure them. And that stays with me. Let me bring you back to Thomas, the man I told you about at the beginning. We treated his cancer aggressively, radiation and hormone therapy. His PSA came down. The scans showed no active disease, but he'll be on hormone therapy for the rest of his life. That means hot flashes, fatigue, loss of muscle mass, mood changes. He accepts it because the alternative is death. But when I sat with him 6 months after treatment, he said something I'll never forget. I wish someone had told me that waking up at night wasn't normal. I thought I was supposed to just live with it. That broke my heart because someone should have told him. His primary care doctor should have told him. His friends should have told him. The men in his community who'd been through this should have told him. But we live in a culture where men don't talk about urination, where discomfort is weakness, where seeking help is somehow unmanly. And that silence is killing us. Thomas is cancer-free now. His PSA is undetectable. He's been off active treatment for 2 years. But he went from being on no medications to being on 4. He went from having normal energy to needing naps every afternoon. He went from a normal sex life to complete erectile dysfunction that didn't respond to medication. Those are the consequences of waiting. Not death in his case, but a significantly diminished quality of life. And all of it could have been avoided if he'd acted on nocturia when it first started. He told me recently, I just didn't know it mattered. Nobody ever explained that waking up at night could be cancer. That's why I'm making this video. Here's what you need to do. 5 actions. Write these down. 1. Track your nocturia. If you're waking up 2 or more times per night, every night, for more than 2 weeks, that's a red flag. Don't ignore it. 2. Get a PSA test. This is a simple blood test. It's inexpensive. It's widely available. If your PSA is elevated, follow up immediately with a urologist. 3. Don't accept, let's wait and see. If your doctor dismisses your concerns, find a doctor who won't. Your intuition about your own body is valid. 4. Know your family history. If your father, brother, or uncle had prostate cancer, your risk is 2 to 3 times higher. You should start screening at 50, not 60. 5. Talk to other men. Break the silence. If you're experiencing these symptoms, someone else in your family or community is too. Share this information. It could save their life. Now I want you to do something. In the comments below, tell me, are you experiencing nocturia? Have you been tested? If not, why not? I read every comment. And if you're hesitating because you're scared or embarrassed, say that too. Let's have an honest conversation. Because this information only helps if we're willing to act on it. If you found this video valuable, share it. Send it to your father. Send it to your uncle. Send it to the men in your life who are over 60 and might be ignoring symptoms. You might be the person who saves their life. And if you want more evidence-based health information designed specifically for seniors, subscribe to this channel. We're not here to sell you supplements or scare you with clickbait. We're here to give you the information your doctor should be giving you, but often doesn't have time to explain. It is never too late to take control of your health. One last thing. Everything I've shared today is based on clinical experience and current medical evidence. But I'm not your doctor. I don't know your specific medical history. So please, don't use this video as a substitute for professional medical advice. If you're experiencing any of the symptoms I've described, see a urologist in person. Get tested. Get a proper diagnosis. This video is meant to inform you, empower you, and motivate you to act. But the action you need to take is seeing a qualified healthcare provider who can examine you, run tests, and give you personalized guidance. Your heart has been working for you every single minute of every single day since before you were born. It's never taken a break. It's never asked for a day off. It deserves a body that's cared for. And caring for that body means paying attention when something changes. Nocturia is a change. Hesitancy is a change. Weak stream is a change. Don't normalize them. Investigate them. Starting tonight.